So we're gonna change over to our award here. I'll get we have the Calico Leadership Award to be presented. So every year at this time, and we've been doing this, gosh, for at least the last 10, 12 years, we present the Calico Award kind of in recognition to someone who's made outstanding contribution to the Flex program. Forrest Calico was one of the very first FORHP program officers for the Flex program. He was born, raised, educated, farmed, and several years ago died in the state of Kentucky. He was a family physician, but also served as a flight surgeon during the Vietnam War, winning a Bronze Star for his care of wounded patients. I believe it was the Vietnam War. I know that he did serve in a war. During his long career, he served as a hospital administrator, a residency program director, a rural physician, and a Flex program officer. He was one of the kindest, nicest people I've ever met, and he provided an extraordinary amount of support for not only the Flex program, but for TASK during the early development phases. One of my favorite memories was when he, myself, and Stephen Jang, who was the Flex coordinator for the state of Hawaii, visited every critical access hospital in Hawaii in 1 week. So probably wouldn't be doing that today, but back then it was just an extraordinary opportunity to learn more about Hawaii and talking to a lot of their leaders. Yesterday, you saw two of our past winners of the Calico Award in Brock Slaba and John Supplett. And we've also presented the award to several Flex coordinators who were retiring, and folks like Dr. Ira Moscovice, who retired from the University of Minnesota Rural Health Research Center, and I understand is now basically volunteering time at primary schools teaching English. So I think that's an extraordinary activity. This year's recipient is John Gale. So I'm really pleased. He's a research associate at Maine Rural Health Research Center. As you might have seen from our agenda, John has already spoken twice at this event. That's just so typical with John. He's everywhere in rural health education and research, both speaking and writing on a variety of topics in a variety of settings. What we've always found is if you ask him for help or to speak or to participate in one of our summit meetings, for example, he's always there. John is a dedicated long distance swimmer. That's one of the things I know about him. And so if he's not speaking or doing research, he's probably in the pool or out on some lake or the ocean as well. And also, like Forrest Calico, he's an extremely nice guy. And it's such a pleasure to present this award to him today. So John, if you are there, do you want to say a few words?
Yes, thanks, Terry. I'm really touched and honored by the award. Like you, I knew Forrest quite well. One of my favorite Forrest Calico memories was during the Anchorage meeting that we did some years back for NRHA. He and I and John Supplett and a handful of others were on the Alaskan Experience, and we traveled to some remote villages together. You know, it's to be considered in that same category is really very touching. So thank you very much. I do have to say that within the world of rural health, and I've been involved with NRHA and TASK and Flex for 20 plus years, this inability for all of us to be together in one place has been difficult, but it also, I think, speaks to how well everyone is committed in the work that's going on. So thank you very much.
I appreciate it, John. this award. You richly deserve it. So it's also nice, at least once a year, to think of Forrest, and it also reminds me of all the other rural physicians out there that have dedicated so much to healthcare. So with that, and we will be sending your award. That's the other thing I don't get to present. I promise it'll be there in your office, or we'll send it directly to your home. So
great, thanks.
You're welcome. So with that, I also have a couple of minutes before I turn this over to Tori Leach. Since we're on the topic of leadership, I also want to acknowledge the leadership that has consistently come from the Federal Office of Rural Health Policy. And all too often, we don't say thank you to those folks. And it's the one federal agency that is a godsend to rural America in terms of healthcare. They, starting in the early days with Jerry Coopy and Jeff Heumann and Wayne Myers, and another rural physician that I hope some of you remember or got to know. Moving into Marcia Brand and today Tom Morris, and then consistently the caliber of the program officers particularly within the hospital division, has just been extraordinary in that time. So I know that everybody here at the center truly appreciates their leadership and their partnership, not only with us, but all of you as well. And I think that's the fact that they consider it a partnership, that they're in this with the rest of us, to me is really pretty extraordinary. So with that, Tori, I'm going to turn things over to you for the final session.
Thank you so much, Terry, and thank you to everyone who has been with us for the past 3 days. We greatly appreciate everyone taking the time out of their very busy schedules to be here with us. And I've just been blown away by all of the amazing topics that we heard. I'm very excited that they will all be recorded so that I can go back and listen to all the breakout sessions I wasn't able to participate in at the moment they were being presented. So with that, I would just like to introduce you all to the new Flex team that'll be shepherding you all through your next program year. So I'll start with myself. This is Tori Leach. I am your Flex program coordinator. I also have the focus area of population health within the Flex program. I'm going to ask each of my fellow Flex teammates to share a takeaway from their time at their birth site visit. And my own takeaway is just how impressed I am with everyone here. You all are doing amazing things with your Flex programs in the face of such challenges and of such competing priorities. So I thank you all so much for your resiliency. And I'm going to turn things over to Natalia.
Hi, I'm Natalia Vargas, and I'm the end equipping quality lead. I just wanted to share my takeaway is really your sense of community. So I am very impressed that everyone was able to really bring that through the presentations and their questions and participation. I think tying it all back to the community is very important and very core to the work that we do here in our division. And I'm just glad that this came through very strongly. One of the sessions that was dedicated to community engagement yesterday, but also throughout. So I'm very glad to be part of this team. And I look forward to working with the new states that I have. Thank you. And I'll turn it over to Laura now.
Here with the Flex team. I've only been on the team for about 3 weeks now. And my takeaway from this visit, this was a bit of my crash course into learning all about Flex. I am blown away by how dedicated everyone is to rural health and to the work that they're doing with their teams and in their states, and just how helpful everyone is to sharing information and answering questions. And I'm very excited to dive in and get to work as a team with all of my states. And I'm also going to be heading up a little bit of the financial and operational side of it with the Flex monitoring team. So I'm really excited to get working with everyone.
Hi, my name is Talia Chappell. I am the new EMS supplement lead and have EMS focus. My takeaway from the meeting really, so just starting on Monday here with the team is just realizing how much there is to learn here about rural health and rural communities. And I just really look forward to working with all of you, and in particular, all the states that are allocated on to work with me. I look forward to learning about all of your states, all your communities, and yeah, so I'm just turn it back to Tori now.
Thank you so much, Flex team. And I'm very excited that we will all be doing Skype meetings for our wonderful NOA NCC overview calls. So you'll get to see all of our faces again very soon. So with that kind of leading of reflection, I would like to lead us all through a bit of reflection. So I have 3 questions here for all of you if you want to take out a piece of paper to jot them down. My first question is what? Write down 3 important facts that you learned during the meeting. And one of them could be that you just met your new project officers and who they are. The so what is what I would like you to share in the chat box if you're able to. Writing down a few things that you learned that will benefit your Flex program moving forward. And then the now what. I would like you to write down 3 names of people who you need to connect with directly after this meeting. This could be an innovative project that you learned, or your project officer who you probably need to connect with, or one of our wonderful keynote speakers from this week. So I'm just going to give us a couple minutes to do that. And if we could have Andy or someone from the Flex team share some of what's being shared in the chat.
And Tori, this is Christy. I don't think the slides are being shared in the meeting, so I'm typing them into the chat box. If everyone can pull up the chat, you can see the questions there as well.
Do we have anyone sharing any information in the chat box?
Yeah, Joyce Hospodar just posted leadership points to consider and share with cause. That was our first comment. Jennifer Edwards said really interested in the palliative care programs that some of the Flex programs have implemented. Catherine Miller said the new leadership trainings that Task is releasing.
Those are very exciting.
Leela Shepard said her so what is share and leverage COVID-19 funding source document with cause. And Stephanie Sayeg said the project on swing beds and the collaboration among Flex programs in Kansas and Illinois is very inspiring. Scott Daniels said incorporating the CCVI and community assessments and leadership trainings. Ronnie Ram, rural COVID funding tool and insights about it. Jill Bullock said, can't wait to listen to other sessions that I missed. That was the benefit of having virtual, going back to other sessions. Agreed. Kyle Cameron, the COVID-19 funding source, financial resources, using funds for out-of-the-box ideas for use that will provide long-term care in infectious disease and the new Flex project officers. Joy Hospodar again said, like the VUCA definition review. Ronnie Ram, rural EMS models and listening strategies. Rebecca Dorbert, Compass updates, palliative care programming, SA and community programming. And Leela Shepard, so what? Or she said, Craig Dio and Studer Group Conference next week. Any others?
That was a great list so far, everyone. Thank you so much for going through this reflection with me. I'm now going to turn things over to the Hospital State Division Director, Christy Martinson.
Great, thank you, Tori. And thanks to all of you for your time here during the past 3 days. Kind of close out items as we wind up this conference. Please complete the electronic assessment that's going to be sent to your email. It's really helpful to get feedback on what you thought of the meeting, what ideas you have. The other thing that TASK will do is distribute information on how to access those recorded sessions. I know, as someone mentioned, and I'm excited to as well, the opportunity to actually be able to attend those other breakout sessions that I missed during the live part of the meeting. Thanks to all of our speakers. We had such great speakers, those outside of the Flex program and those from inside the state Flex programs talking about what you're doing. So thanks to everyone. Thank you to all of the Flex partners that we have, the Flex monitoring team, Arquita and TASK. You saw what they provided at the presentations today, and I know in all the sessions there were comments of how helpful staff are across those partners and the resources that they provide are as well being so valuable. So thank you to all of you. Thank you to the Flex team. So grateful for Tori and Natalia for being our 2 Flex team members for many, many months this year, and appreciate all the work they did preparing for this meeting, and so excited for the new team members that we have, Laura and Talia. And so we look forward to going into this next year with a full team of 4 to support you. Thanks also to the conference planning committee. I know from when you were having the sessions early on this year, it kind of completely shifted to a virtual mode, but the sessions still stayed the same. So appreciate all of your thought in coming up with a great strategy for the meeting, the theme, and really getting good sessions together. Thank you also to TASK for all you did. You always put on a smooth meeting, but really being able to shift things and figure out how to make it work virtually, it really went well. So I know it's not easy, and this was the first time, and I thought it was a great success. So thank you to all that you did and the Perform Media team as well for making it so smooth. So thank you again to all of you for attending and for the hard work that you put in during the meeting and for what you're going to go back to the dedicated work that you do with rural hospitals. We appreciate all that you do for rural communities. So thank you for your time and enjoy your afternoon and not having to get on a plane to go home.